He has come for cancer, CA, larynx with stripping of the cords, is not able to speak. And what does he say? My daughter got divorced, and then he says, you can understand how it is. One after the other grieves with this. Though he's an infantryman, how he wept, first time he must have wept actually. Because he seemed a personality who takes responsibility for himself and for all his troops. So there is tremendous high responsibility. It is not only my family, my children. No, where it is indicating which line of periodic table. Let's simplify. What has to be healed? We need to heal, the remedy needs to heal grief, sadness, which is suppressed. The theme of over responsibility needs to be healed, where it is the leadership line is of 6th row. And he received the remedy from column 11, that is aurum metallicum, 200 BD for 2 days, followed by LM6. He was also given the nosode Serenum, considering the affection of cartilaginous parts, because vocal cords are cartilaginous tissue and they have become hardened. That's why there was stripping, and yet he was able to speak, means there is little movement is there. But considering that, Serenum as a at the start of the treatment, followed by ornament. For bad effects of radiation, cobaltum met clinically 30 potency was given to him as SOS, but he did not receive any radiation, which was planned. 15 radiations, the doctor said, radiologist said, no need at all. And his PET scan was supposed to be done after 6 months or so, which he said, I will be going in Delhi and doing. He did the PET scan, he was much better. But after that, what happened, let me tell you. After again, he was there in Delhi and he had severe pain in the renal hepatitis kind of symptoms he developed. And somehow at that time, he was not able to contact me and he was hospitalized. He was pumped with medicines, pumped. And after 2 months, he passed away actually, after 2 to 3 months. So what happens is many times there is no awareness about what I felt, okay, he died or what all. But we could have helped in that hepatitis. But the family at that time, he went and then he was there at his daughter's place. They didn't realize, and hospitalization and a lot of medications, and somehow no touch with me at that time. He was very well for a year, and after that he developed simple hepatitis had developed. So the thing is, that's why follow up or calling up the patients if they have not called. I even do that, okay, how are you? Or I send some message, because this awareness of homeopathic cures needs to reach, and we need to see patient for at least 5 years. Good follow up should be there. Though we don't tell patient 5 years, otherwise they will say no homeopathy. They feel homeopathy will take time and it will take so many years. No, follow-up is important to know how is the patient doing. Is anything coming up later on? Any acutes, any fevers, any kind of affections. So that's how we need to monitor. And that's how when in a research study, we have to close follow-ups are very important. And that helps to really, build our science on a solid foundation. Laryngoscopy was clear, NAD, he told. So, with all my thanks to all my patients who have allowed this to share their videos and not mask the face. So, do not share this information. I am very thankful. They made me learn so many things and they are helping us to learn as a group also. So, I thank all these patients for what all they shared from the depth of their hearts, and we were able to give a good remedies and able to heal them. This is how the gentle power of simplicity can transform the homeopathic practitioner into healing artist. And I thank you all for the patient listening.